Your Excellency, the President of the Republic of the Gambia, Madam Barrow, Justice C, representing the Chief Justice of the Gambia, Madam Claudia Cole, representing the Minister of Health and Social Welfare, all of the cabinet ministers here present, members of the diplomatic corps, security chiefs, permanent secretaries, directors, trustees of Horizon Trust, private investors to Horizon's Clinic, the consultant to the implementation of the project, my Lord spiritual, family and relatives of James Now, friends, colleagues, distinguished ladies and gentlemen. It is with great pleasure and happiness that I welcome you all, and in particular, His Excellency the President and your team for finding time to attend this event. Your Excellency, your presence here with the members of your government is a reflection of your commitment and positive leadership to quickly grasp the importance of the project and according it the priority it deserves as one of the key ingredients for the socio-economic development for the country. Mr. President, distinguished guests, I have three messages. The first is that today is a great day for the health sector in the Gambia. Great in that Horizons Trust Gambia is the philanthropic arm of the Horizons Clinic. The Horizons Trust Gambia is, as the main beneficiary of Horizons Clinic, will receive funds from profits of the clinic in addition to funds mobilized from other sources and partnerships to supplement the efforts of government in health service delivery. The vision of the trust is inextricably linked to that of the clinic, that is, preventing mothers and children from dying by focusing on the basic principles of infection prevention and control, particularly during delivery. The trust so far, ladies and gentlemen, Your Excellency, has spent in excess of $2 million to support maternity units in 6 health facilities, namely Serekunda Health Center, Kafuta, Fajikunda, Brikama, EFSTH, and the Foundation for Peace Hospital. Initially, the trust focused on the training of nurses, orderlies, and support staff on infection control and prevention. However, we realized that such training, to be effective, there needs to be a change in the working environment. In this regard, we moved on to support infrastructural works, such as the solarization of the maternity wings in Fajikunda and Serekunda health centers for assured uninterrupted light and hot water supply, revamping of the drainage systems to ensure that soakways, toilets, tubs, and showers are all functioning. Washing machines were provided for Serekunda and Fajikunda so that laundresses no longer use their bare hands to wash soiled materials. Over the past year and to this date, cleaning materials such as detergent and bleach are being provided to these facilities. At this stage, Your Excellency, ladies and gentlemen, I would like to recognize the trustees and thank them for the support and commitment they have provided to the trust. His Lordship the Bishop Allison of the Gambia, Dr. Ulrich Jones, a renowned surgeon, Mr. Augustus Prom of the Augustus Prom Associates, and Dr. Lamin Marina, who unfortunately could not be here also. Absent also are Mr. Aki Allen of the Gambia Electrical Company and Mr. Pitendau. Thanks to you all. Thanks also to our indefatigable support manager and administrator, Tina Manjang. Let me also take this opportunity to thank our beneficiary manufacturers, Brussels Airlines, Africa Bike Ride, Ngala Lodge, Soapbox, and the UK Horizons Trust for all the financial, material, and moral support. Your Excellency, the second message is that Horizons Clinic is good for the socio-economic development of the Gambia. The clinic will provide jobs during its construction, jobs when operational. The clinic will provide jobs for health workers. The clinic will collaborate with the medical school to provide residency and internship programs for doctors, nurses, and other health workers. Above all, it will boost the tourism sector by providing the quality health care that is being demanded by high-level tourists and medical tourism per se. My third message, Your Excellency, is that of celebration. Celebration of James Dow. Not the life of James Dow, because he's still a young man. He's not gone from us yet. I remember James as a young boy going to Aberdeen to study medicine. He excelled at medical school and secured all the required surgical training to become a urological surgeon, and in addition, bagged a PhD. As a consultant surgeon, at the age of 40, he was elevated to the prestigious position of professor of urological surgery and director of the academic urology unit in the University of Aberdeen. And thereby assuming the first chair of urology in Aberdeen's history. According to a press release from the University of Aberdeen, and I quote, Professor Dow has put Aberdeen's urology expertise on the map. Professor Dow, a urology expert, is a co-founder and managing director of the urological cancer charity, UCAN. He is one of a few world-renowned experts in the field of urology. UCAN has raised around $30 million so far and funded the opening of the first urological care center in Scotland, formally launched by the health minister in 2008. James was also the coordinating editor within the Cochrane Incontinence Review Group from 2008 to 2012. His research interests are in evidence synthesis and evidence-based practice, large observational studies, and multi-center randomized clinical trials with a competitive research grant of over $30 million. Professor Dow has a urological surgical practice in Aberdeen Teaching Hospital, subspecializing in penile, and urethral surgery. Currently, Professor Dow is the chairman of the Guidelines Office Board of the European Association of Urology. Mr. President, these are no mean achievements. James, over 10 years, was part of a surgical team performing surgical operations at the EFSTH hospital. However, faced with numerous challenges, James came up with the idea of setting up a clinic that he will have control over and be able to provide quality care and at the same time providing support for those who cannot afford such services through a sustainable basis in a philanthropic platform, therefore putting in place a new paradigm for poverty alleviation. This is how Horizons Clinic was born. James made numerous trips to the USA, Europe, and parts of Africa, establishing and galvanizing partnerships. On his idea, he finally convinced the ADB and the IDB to be interested in this area and to commit financing to the project, in addition to private equity. This is a project, ladies and gentlemen, Your Excellency, that has been scrutinized through the eye of a needle and supported by numerous studies and analysis from top world consultants such as the Oxford Policy Group to establish, and verify its viability. The project has gone through all due diligence and has taken over 10 years to arrive at this stage. Your Excellency, ladies and gentlemen, the vision of James is to make this clinic one of excellence, so that many will not have to leave the shores for further treatment elsewhere, but also that many will come to these shores for quality treatment. James's vision is that in the near future, Horizons will be one of a number of such centers providing quality care in the Gambia and working together with other colleagues for a better and healthy Gambia. As I draw to a close, kindly allow me to recognize Dr. Kathleen Dow, the wife of James, who with the children bore the numerous lonely moments when James had to travel across the world to promote the project. Thank you, Kathleen and children. And here I beg your indulgence, as you sit in your chairs, please just remember and say a little prayer for Dr. Dow and Mrs. Dow, father and mother of James, who but for a call to higher service would have liked to be in person and to be proud of James. However, we know that they are with us in spirit. In the same manner, I kindly want you to remember and say a prayer for the late Dr. Hatib Jai, who passed away last year. He was the first secretary of the Horizons Trust. He served with diligence and commitment. Let me also thank the team, and here I can recognize Omar Kamara, William Jai, Jamila, and Tina herself, and so many behind the scenes, whom I cannot mention for reasons of time, for the sterling work they have done in transforming the environment to make it conducive for this event. Allow me, Mr. President, also to thank all those who in one way or the other gave unflinching support to the program in the last dispensation. Finally, let me thank again Your Excellency the President for grasping the idea of the clinic and for giving us all the required support with your cabinet colleagues and officials. We can understand that it is not too easy to prioritize and make decisions among competitive priorities in the first few months in office. You have done well, and you will continue to do well. As regards to the Horizon journey, Mr. President, allow me to end with the modification of the famous lyrics of the one and only Osibisa. Horizons Clinic is going. We are moving. The road has been hard, muddy, and rough. We are almost there. Heaven knows how we will get there. However, with your support and all stakeholders in your government and beyond, heaven knows we will get there. We know we will. Thank you, and God bless you all.